Добрий день, я вітаю.
Welcome everybody joining us today at the media center of the Ukrinform on the day of 179 of the full-scale invasion. Today's topic is massively important. It's about mental health of the population. Why is it important and what measures are especially efficient? I would like to introduce to you today's speaker, Fami Hanna, who is the expert of the WHO Geneva headquarters, co-chair of the reference group of mental health and psychological support of the population. Welcome, sir. Let us talk about why this is important and what is the most efficient way to act to secure the mental health of the population.
An honor to join you today. WHO estimates that 1 in 5 people in conflict settings would suffer from a mental health condition. This means, in a war context, there would be larger number of people with mental disorders. And people with pre-existing mental health needs would have difficulty in accessing the limited services available. Even before this war, Ukraine was doing serious efforts to scale up and modernize its mental health care and turn it into community-based mental health services. Ukraine, for example, since 2020 was one of the first countries in the world that joined the WHO Special Initiative for Mental Health to scale up universal health coverage for mental disorders. From the outset of this emergency, the Ukrainian government, under the auspice of the First Lady of Ukraine, in coordination with the Interministerial Steering Group for Mental Health and Psychosocial Assistance and the Ministry of Health, have developed a roadmap that include a priority set of multi-sectoral mental health and psychosocial support actions during and after the war. This roadmap was really inspiring for neighboring countries hosting Ukrainian refugees and displaced population. So in fact, in 2 weeks from now, the WHO European office in Copenhagen will be hosting a meeting with mental health focal points from countries such as Poland, such as the Czech Republic, such as Hungary and others to discuss and adapt the Ukrainian roadmap to the context of the Ukrainian refugees. Again, from the outset, WHO has been very active in supporting all these initiatives. WHO took all the resources, the best standards in mental health and psychosocial support, translated and adapted into Ukrainian and neighboring countries' context. Large number of experts, and I have the honor to be deployed several times to Ukraine, in fact since 2015, have been deployed frequently to Ukraine and neighboring countries to support the Ukrainian affected population. WHO also leads the interagency mental health and psychosocial support coordination group in Ukraine that include more than 150 national and international partners working in this area. Dear audience and colleagues, WHO and partners' vision in mental health and psychosocial support is very clear. Reduction of suffering and improve mental health and psychosocial well-being of every girl, boy, man and woman in Ukraine affected by this war, during the war, recovery phase and rebuilding phase. For every country, rebuilding sustainable mental health care systems during and after emergencies should be a priority. I'm quoting here the First Lady of Ukraine in her speech at the 75th World Health Assembly. She said, "This battle will be over. Every displaced Ukrainian will return. Each family will be reunited and wounds will heal. Destroyed schools and orphanages and hospitals in Ukraine will be rebuilt. But the consequences of this war, unfortunately, will remain for years and decades." Dear audience and dear colleagues, wars, despite their tragedies, sometimes represent opportunities for countries to revisit their mental health systems and care. It is an opportunity for Ukraine and for and also its neighboring countries affected by this war to rebuild and revisit their mental health care and scale it up. We hope that with the national leadership and national authorities in Ukraine, their leadership in scaling up mental health services, this can be a good role model for other countries in other affected areas by wars around the world. Thank you.
Які найтиповіші?
What are the most typical signs that a person needs to turn to the psychological and mental health? What are the most typical traits and signs that a person needs to turn to the specialists in health, psychological and mental health?
In war situations, stressful experiences are common. People may lose loved ones, lose their property, have to leave their home, have difficulty in access to basic needs. Also in war situations, psychological distress is common. So people may feel helpless, hopeless, sad, anxious. In fact, this stressful situation and psychological distress due to abnormal situation are normal reactions for normal people due to abnormal situation. We get worried when this stay for a while and start to affect functioning. We know that in war situation also mental disorders tend to increase. 22.1 is the percent. This is more than double the rate in peaceful times. Conditions such as depression, such as anxiety, schizophrenia, bipolar disorder tend to increase during and after wartime in conflict-affected population. But what we also need to remember is that even without war, in any country in the world, there are people with pre-existing mental health conditions. People who are having depression even before the war. For these people, the war is even more stressful situation, and this is a more vulnerable population that will benefit from scaling up mental health and psychosocial support services.
Ці виклики, з якими
The challenges that Ukraine is facing now, we understand, is a challenge not only for the civilians, but also for the military, those who are defending this country. And the issue of their mental health is massively important for Ukraine. What, in your opinion, must the state of Ukraine do to help and aid our military?
In my opening remarks, the Ukrainian government has developed a roadmap for scaling up mental health and psychosocial services. Part of this roadmap was services specifically for those on the front line of this war and also for the veterans. From WHO experience in other countries, this is a very vulnerable group. And we need to think about them holistically as well, not only as an individual, but also as part of their communities and also to remember their families. So what we recommend to countries in this context, and what is reflected also in the Ukrainian roadmap, is to make sure that these services are integrated into existing services, either into general health care or social care services. There are packages that WHO and partners have developed. For example, the Image Gap Humanitarian Intervention Guide or the Self-Help Guide. There are many packages which are evidence-based that can help this population group. Integration is the key, and prioritization by policymakers is currently happening in Ukraine, and investing in the mental health of the population, not only as individual, but as part of the community for them and their families.
Шановні колеги, я прошу ваше.
Dear colleagues, questions from the floor. Tkachuk Svetlana from Ukrinform agency. In your opinion and your assessment, how many Ukrainians are in the need of the psychological and mental help right now?
Question. Based on our projected estimates for population affected by mental health needs during and after emergency, our estimates is 1 in 5 of the population affected. If you apply this rate for the whole Ukrainian population, you will have more than 8.5 million persons who are affected by mental health condition. We are talking here about moderate to severe mental health condition. If we talk about severe mental health conditions, that would be 5.1%. When we say severe conditions, including schizophrenia, severe depression, or severe post-traumatic stress disorder, or severe anxiety. So these are the rates, 22.1 and 5.1.
Олег Бойчун, Інтерсвіт.
Interswede, the war has many facets, but today the state is dealing with the post-traumatic adaptation. To tomorrow, as you mentioned, children will forget what the war was, but the military will remember forever that kind of experience. We have developed non-medical help for schools, for the libraries. The country is now engaged in waging the war and rebuffing the aggressor. What can we do else?
Field of mental health and psychosocial support, we need to be attentive that this is a multidisciplinary area. While the health and social sector is extremely important, but engaging with sectors such as, for example, education and media and others is extremely important. And the Ukrainian government has, as I said, has been very attentive from outset to this area and established the interministerial mental health and psychosocial support or psychosocial assistance coordination group that involve ministries such as the Ministry of Education and Ministry of Veterans and others. The approach to mental health and psychosocial support need to be multidisciplinary and engage sectors beyond the health and beyond the social sector to make sure that we provide holistic support. WHO and partners such as Save the Children and UNICEF has developed intervention, one of them called, for example, I Support My Friends. How we can convey to young adults, to adolescents, set of skills on psychological first aid, so that they can listen to their peers under supervision of adults such as their teacher. We develop packages also that teachers can use to cope with their own stressors and to support the children and young adults at school as well. But the key point here is multidisciplinary approach to this area of work. Thank you.
Зараз наша країна
Currently, our country has entered an active stage of war. We are witnessing how Ukrainian military has been successful recently liberating cities and settlements. Is WHO ready to get engaged with the help to the people in these newly acquired and liberated territories, people who have spent so much time under the occupation?
We are a very vulnerable population group and exposed to many of the war impact at the front lines. That would be a priority group to provide interventions in a situation like this. WHO would assess the current situation, what is the infrastructure, what services are already available. We try to build coordination by linking to different partners who would be in the locality and try to build the capacity of the local affected populations and organization to scale up. I agree, this would be a very vulnerable group that need to be prioritized indeed.
Я дякую вам.
We appreciate your being here, the fact that you have come to Ukraine and helped this country in this most important period in our social and political life. Thank you, my friends, for being interested in this important topic. Stay with us. We are now framing the agenda for tomorrow, and we'll wait for you here tomorrow. Thank you.
And I really appreciate the great work done by the mental health and health professionals in Ukraine. It's an